Here, in the United Kingdom, there's a big debate going on today, all about the welfare state and how, literally, the sort of claimants of that have shot up. And it's not difficult to see why. The story that they're trying to put out there is all about the Gen Z society and how, of course, younger people now don't want to work ever since the pandemic because they've got used to a different lifestyle. And I'm sure there's an element of that in that particular story. The bigger element, though, literally, is this, and it's one that the government don't want to share. Let me explain. Hi, good to see you, chums. Thank you so much as ever for taking the time out to join me. It is fascinating when you look at this because it's also very terrifying for genuine people that are suffering from all manner of disabilities and that sort of thing, whether it's mental health, literally mobility. People rely on their benefits. There's always a segment that are going to, of course, encapsulate that and decide to fleece the system. But of course, while they're trying to cut it across the board to make sure that it's very simple and easy, it's interesting to note, of course, that the current government don't want to offend their core voter, the ones I mean. Now, when you look at it this way, and you have to think of it in a bigger picture, put yourself in the position of if you're now going to an NHS hospital, right? And I was in there recently with a colleague of mine, and the bottom line was this. We were waiting and waiting and waiting, and it was a simple thing of this. A group of people from another country who were illegally here had to be found a translator. And they couldn't find the right translators, so everybody else had to wait because, they couldn't move forward and these people weren't going to move. There was literally nobody in the group that could understand or indeed translate exactly what people wanted. And it's the same with the DEI officers. If you got rid of all the translators, all the interpreters out of the NHS, then quite frankly, you would be saving millions of pounds. And the core money would be going to the people that are here, that have paid tax, that should receive all of that treatment that they need, whether that be ex-police officers that have found themselves in difficult circumstances, army veterans, or simply the elderly who through no fault of their own find their mobility issues have rendered them incapable of either going to work or indeed getting out. It's just a simple things, isn't it? Of having an ambulance to be able to take you for your appointment, or an ambulance car or something like that. But of course, according to a very well-placed source, and this of course is directly back at the current health minister, Wes Streeting, you see, they don't want to get rid of that because that's their core voter. Many people are suggesting they're simply importing their core voter in. And what was fascinating about being in this hospital with these interpreters is the money that they're making. And when I was chatting to them, every time they're called out, they rack up another fee. And as more and more people are coming into the country who are not speaking English, who do need an interpreter, a translator, well then they're getting richer and richer. And this is all coming out of the pot of the NHS. So while people say it's good to cut welfare and slash it across the board, how about starting with something like that? You could save millions without very much effort. Anybody else agree? Neil Sean in the very heart of London.